Good evening and thank you for joining us. The Thunder Bay District Health Unit is reporting 4 more COVID-19 related deaths, and COVID cases here in the Northwest are now among the highest in the province. Dr. Janet DeMille says that's because the 7th wave is peaking later here than in other parts of Ontario. Lee Noonan has more.
COVID rates in Thunder Bay have surpassed the provincial average by more than 100 cases per 100,000 people, and rates in the Northwestern unit are nearly double that again. However, Health Unit CEO Dr. Janet DeMille says comparisons between health units aren't always reliable, as some jurisdictions, notably First Nations communities, are conducting more PCR testing than others. She says the numbers do reflect a delay in the 7th wave, which has been declining in the rest of the province while it is only now peaking here.
There's evidence that we've reached the peak right now, and maybe hopefully, perhaps starting to see some decline, but hope to see that manifest more over the next week or two.
The 4 latest COVID-related deaths bring the total to 8 in the past 3 weeks, which DeMille says reflects the increase in cases. She says that generally it is older and more vulnerable people who are at higher risk of severe outcomes, including death. But she adds that young, healthy, vaccinated people should still be wary of long-term consequences such as long COVID or the effects of repeated infections.
This is not a cold. It's not like rhinovirus that gives you a runny nose. This virus in general has the potential for more significant consequences.
She recommends that everyone stay home when feeling sick, wear masks when indoors, and get outside as much as possible. In the meantime, the rollout is well underway for the monkeypox vaccine. Most of the 50 doses that were sent here have already been administered to those at highest risk, with only a very small number of vaccines still available.
We do have to keep some aside in case we have a case and have to get out and immunize people who are close contacts. So, and we've ordered more. So it's
anyone who thinks they may be at high risk for monkeypox is encouraged to call the health unit. In general, the risk of contracting the virus is low, and most people recover from it without treatment. Lee Noonan, TBT News.